Pain specifically on the left side of your lower back is not random. The fact that it is only on one side, and specifically the left, narrows down the cause significantly and tells us a lot about what is actually going on inside your body. It could be a muscle problem, a spinal problem, an organ problem, or a nerve problem, and the treatment is completely different depending on which one it is. In this video, I am going to walk you through every major cause of left-sided lower back pain, how to identify which one is affecting you, and the exact steps to get rid of it. Let's get straight into it. Why the pain is only on the left side? The first thing most people wonder is, why is the pain only on one side? If it were a general back problem, wouldn't both sides hurt equally? Not necessarily. Your body is not perfectly symmetrical. The muscles on each side of your spine develop differently based on your dominant hand, your posture habits, how you sleep, how you sit, and how you move. On top of that, your internal organs are not arranged symmetrically either. Your left kidney, the descending colon, parts of the reproductive system, and other structures sit specifically on the left side of your body, and any of these can refer pain directly to the left lower back. So left-sided lower back pain is almost always pointing to something specific, either a structural imbalance in the spine and muscles on that side, or an organ on the left side that is under stress. Let's go through each cause one by one. Common causes of lower back pain on the left side. Number 1. Muscle strain or spasm on the left side. This is the most common cause by far. The muscles running along the left side of your lower spine, particularly the left erector spinae and the left quadratus lumborum, can become strained, overloaded, or go into spasm from a single wrong movement, from lifting something heavy, or simply from years of postural imbalance. When these muscles are in spasm, they create a sharp or aching pain that sits firmly on the left side and often gets worse when you bend, twist, or stand up from a seated position. A key indicator of muscular pain is that it changes with position and movement. It is worse in some positions and better in others. It usually came on after a specific activity or woke you up after sleeping in an awkward position. Number 2. Lumbar disc herniation on the left side. The discs between your lumbar vertebrae can bulge or herniate, meaning the soft inner material pushes out through the outer layer and presses on nearby nerves. When this happens on the left side of the disc, it compresses the nerve roots that travel down the left leg. This creates a very specific pattern of pain, lower back pain on the left that shoots, burns, or tingles down the left buttock, thigh, and sometimes all the way into the foot. This is called sciatica, and when it only affects the left leg, it almost always means the disc herniation or nerve compression is on the left side of the spine. Number 3. Sacroiliac joint dysfunction on the left. The sacroiliac joint, or SI joint, connects the base of your spine to your pelvis on each side. When the left SI joint becomes inflamed, misaligned, or overly stiff, it causes a deep aching pain in the lower left back that is often mistaken for a lumbar disc problem. The pain from a left SI joint issue typically sits just to the left of the center of your lower back, right at the level of your belt line, and often radiates into the left buttock. It is frequently worse after sitting for long periods, when climbing stairs, or when standing on the left leg alone. Number 4. Left kidney issues. Your left kidney sits just below the left side of your ribcage, close to the back. A kidney stone, kidney infection, or kidney inflammation on the left side creates a deep, persistent aching pain in the left flank and lower back that is very easily mistaken for a muscular or spinal problem. The key difference is that kidney-related pain does not change with posture or movement, is often accompanied by changes in urination, such as burning, frequency, or dark urine, and may come with nausea or fever. If your left-sided back pain does not shift at all when you change position, and especially if you have any urinary symptoms alongside it, your left kidney needs to be investigated. Number 5. Descending colon and digestive issues. The descending colon, the section of the large intestine that carries waste downward on the left side of your body, sits directly in front of your left lower back. When this section of the colon is inflamed, backed up with stool, or filled with trapped gas, it creates pressure that pushes against the left back wall. The result is a left-sided lower back ache that is directly driven by what is happening in your gut. This type of pain is often worse after meals and improves after a bowel movement or passing gas. Number 6. Left-sided sciatica. The sciatic nerve is the longest nerve in the body. It originates from the lower spine, passes through the piriformis muscle in the buttock, and travels down the entire leg. When this nerve is compressed or irritated specifically on the left side, whether from a disc herniation, a tight piriformis muscle, or spinal stenosis, it causes a radiating pain that starts in the lower left back and travels into the left buttock, the back of the left thigh, and sometimes down to the left calf or foot. It often comes with a burning, tingling, or electric shock sensation. Number 7. Poor posture and muscle imbalance. If you consistently sit with your weight shifted to one side, cross your legs with the left leg on top, sleep on your left side in a poor position, or carry bags on your left shoulder, you are loading the left side of your spine unevenly over time. The left back muscles work harder, fatigue faster, and eventually develop chronic tightness and pain. This is one of the most common and most overlooked causes of one-sided lower back pain. And the fix is straightforward once you identify the habit driving it. Number 8. Reproductive organ issues in women. For women, left-sided lower back pain can be caused by conditions affecting the left ovary or left side of the uterus, including ovarian cysts, endometriosis, or pelvic inflammatory disease. This type of pain often follows a cyclical pattern tied to the menstrual cycle, maybe accompanied by pelvic pressure or cramping, and does not respond to the typical back pain. Treatments. If your left back pain consistently worsens around your period or comes with pelvic symptoms, a gynecological evaluation is important. Number 9. Piriformis syndrome on the left. The piriformis is a small but powerful muscle that sits deep in the left and right buttock, directly on top of the sciatic nerve. When the left piriformis becomes tight or inflamed from prolonged sitting, overuse, or a direct injury, it compresses the sciatic nerve underneath it and creates pain that feels like it is coming from the lower left back, the left buttock, and sometimes radiating down the left leg. This is frequently confused with true disc-related sciatica, but the origin is the muscle, not the spine. How to identify your specific cause? Before jumping into solutions, use these questions to narrow down what is most likely driving your left-sided pain. Does the pain change when you move or change position? If yes, better in some positions, worse in others, the cause is almost certainly muscular, spinal, or joint-related. If the pain does not change at all regardless of how you move, an organ cause such as the kidney or colon is more likely. Does the pain travel down your left leg? If the pain shoots, burns, or tingles from the lower left back into the left buttock, thigh, or leg, you are dealing with nerve compression, either from a disc herniation or piriformis syndrome. The exercises and stretches for nerve-related pain are different from those for pure muscular pain. Is the pain deep in the left buttock as well? If the pain is concentrated in the lower left back and the left buttock together, without much leg involvement, the sacroiliac joint or the piriformis muscle is the most likely cause. Does the pain worsen after eating or improve after a bowel movement? If yes, the descending colon and digestive system are involved. Treat the gut alongside the back. Do you have urinary symptoms, or does the pain not move at all? If yes, investigate the left kidney with a doctor before applying self-treatment. Exact solutions: how to get rid of left-sided lower back pain. Here are the specific fixes that target the most common causes of left-sided lower back pain. Apply the ones that match your situation based on the identification questions above. Fix 1. Left quadratus lumborum stretch. This targets the deep muscle running along the left side of the lower spine that is responsible for a large proportion of one-sided lower back pain. Stand with your feet shoulder-width apart. Raise your left arm overhead and lean your entire torso slowly to the right, creating a long stretch along the left side of your lower back and flank. Hold for 30 to 45 seconds. Do 3 sets. On the left side, twice a day. Most people with chronic left-sided lower back pain feel immediate relief after this stretch, because the quadratus lumborum on that side has been tight and shortened for months, or even years without ever being properly stretched out. Fix 2. Left piriformis and SI joint stretch. Lie flat on your back with both knees bent. Place your left ankle on top of your right knee, creating a figure 4 shape. Gently pull your right thigh toward your chest until you feel a deep stretch in the left buttock. Hold for 45 seconds. Do 3 sets. This stretch simultaneously releases the left piriformis muscle and mobilizes the left sacroiliac joint, addressing 2 of the most common causes of left-sided lower back pain in a single movement. If you feel sciatic tingling during this stretch, ease off slightly but stay in the position. The nerve is being gently flossed, which is therapeutic. Fix 3. Knee to chest lumbar decompression. Lie flat on your back. Pull both knees toward your chest and hold for 30 seconds to decompress the lumbar spine overall. Then pull only the left knee to your chest while keeping the right leg extended flat on the floor. Hold for 30 seconds. This provides a targeted decompression of the left side of the lumbar spine, takes pressure off the left disc and nerve roots, and releases the left erector spinae. Do this sequence every morning before getting out of bed and every evening before sleep. It takes less than 3 minutes and delivers consistent relief when done daily. Fix 4. Sciatic nerve floss for left-sided sciatica. If your pain travels down the left leg, nerve flossing is essential. Sit upright in a chair. Straighten your left leg out in front of you while simultaneously tilting your head back and looking up at the ceiling. Hold for 2 seconds, then bend your left knee back down and lower your chin to your chest. Repeat this slow, controlled movement 10 times. This technique gently mobilizes the sciatic nerve along its full length, reducing adhesions and inflammation around the nerve sheath. Do 2 sets of 10 repetitions twice a day. Never perform. This aggressively, gentle and controlled is what makes it effective. Fix 5. Left side, strengthening to correct muscle imbalance. One-sided back pain is frequently the result of weakness on that side, causing the muscles to overwork and fatigue. The 2 best exercises to correct left-sided weakness are the left side plank. Lie on your left side and push up onto your left forearm and the side of your left foot, keeping your body in a straight line from head to heel. Hold for 20 to 30 seconds. This directly strengthens the left quadratus lumborum and left oblique muscles, the exact muscles that are typically weak and overloaded in left-sided back pain. Do 3 sets, 3 to 4 times per week. The single leg glute bridge on the left. Lie on your back with knees bent. Extend your right leg straight out. Push through your left heel and raise your hips off the ground, squeezing the left glute at the top. Hold for 3 seconds, lower, and repeat. Do 12 reps per set, 3 sets a week. Left glute is one of the most common hidden drivers of left-sided lower back pain. When the glute is weak, the lower back overcompensates and eventually breaks down. Fix 6. Heat therapy, targeted to the left side. Apply a heating pad specifically to the left side of your lower back for 15 to 20 minutes. Do not place it across the full back. Focus the heat on the left side to maximize blood flow and muscle relaxation in the exact area that needs it. Follow the heat immediately with the quadratus lumborum stretch while the muscle is warm and more pliable. This combination works significantly faster than stretching alone. Fix 7. Correct your postural habits. If poor posture and one-sided loading are driving your pain, you must address the habits directly. Stop crossing your left leg over your right when sitting. This consistently loads the left SI joint and rotates the left side of the pelvis. If you carry a bag, alternate shoulders daily, rather than always using the left. If you sleep on your left side, place a pillow between your knees to keep the pelvis level and reduce strain on the left lumbar muscles. Check your sitting posture right now. Is your weight even across both hips or shifted to one side? Most people with one-sided back pain are sitting unevenly and have no idea. Shift your weight to center, sit up tall, and make this your new default position. Fix 8. Address the gut if digestive causes are present. If your left back pain worsens after meals or improves after bowel movements, treat the gut. Alongside the back, drink 2.5 to 3 liters of water daily to prevent constipation. Take a 10 to 15-minute walk after every meal to stimulate gut motility. Reduce gas-producing foods and inflammatory foods. Do the clockwise abdominal massage for 5 minutes before bed. When the descending colon is no longer putting pressure on the left back wall, this component of the pain disappears quickly. When to see a doctor? See a doctor promptly if you experience any of the following alongside your left-sided lower back pain: numbness, weakness, or complete loss of sensation in the left leg. This suggests significant nerve compression that needs imaging. Pain accompanied by fever, chills, or burning urination. This points to a kidney infection, requiring antibiotics. Severe, sudden left back or flank pain that comes in waves. This can indicate a kidney stone. Left-sided back pain in women that follows a menstrual pattern or comes with pelvic pressure. Gynecological evaluation is needed. pain that is rapidly worsening over days and is not responding to any position or self-treatment, loss of bladder or bowel control alongside back pain. This is a medical emergency and you must seek care immediately. Your simple 30-day daily routine. Follow this routine every day for 30 days to systematically eliminate left-sided lower back pain. Every morning before getting out of bed, do the knee-to-chest decompression, both knees. First, then the left knee alone. This takes 2 minutes and starts your day with a decompressed, relaxed left lumbar spine. Every morning and evening, do the left quadratus lumborum stretch, 3 sets of 45 seconds, leaning to the right. This is the single most important stretch for one-sided lower back pain and must be done consistently. Every day, do the left piriformis figure 4 stretch, 3 sets of 45 seconds. This addresses the SI joint and piriformis simultaneously and prevents the deep buttock tightness that feeds into left back pain. If leg pain is present, add the sciatic nerve floss, 2 sets of 10 reps twice daily. Do not skip. This if you have any left leg symptoms. 3 to 4 times per week, do the left side plank and the single leg glute bridge on the left side. Building strength on the left side is what creates lasting relief rather than temporary comfort. Every evening, apply a heating pad to the left side of your lower back for 15 to 20 minutes, then immediately do the quadratus lumborum stretch while the muscle is warm. Every day, check and correct your posture. Even weight on both hips, no leg crossing, bag. On the right shoulder today if it was on the left yesterday. Small daily corrections compound into significant structural changes over 30 days. That is everything. Every major cause of lower back pain, specifically on the left side. How to identify your specific cause and the exact fixes to get rid of it. If this video helped you understand your pain better, hit the like button and subscribe for a new back pain solution video every week. Leave a comment below telling me whether your pain stays in the back or travels into the left leg. I will reply personally and point you to the most relevant exercises for your exact situation. I will see you in the next one.